family are enjoying a morning walk in the hills above Rome. But they haven't travelled 170 kilometres to the Italian capital just to see the sights. They're here for a much more important appointment.
Our son Giordano has a disease called Bicuspid Aortic Valve. And this causes his ascending aorta to swell and expand.
Every 3 to 6 months, Giordano has to undergo complex medical exams in hospital, including cardiac MRI scans. The doctors are keeping a close eye on him in order to decide when and if he'll need heart surgery. It's not easy with existing techniques.
The classic criteria for being suitable for surgery is judged by measuring the gradual enlargement of the aorta. This helps us see when a patient's life might become at risk. The problem is that this standard criteria is not always accurate and reliable. We know that some 20 to 30% of patients may develop serious problems even before we determine that they're suitable for surgery.
So European researchers have developed sophisticated computer models with personalised data on patients' cardiovascular systems. And that includes the effect that certain diseases have on the behaviour of the ascending aorta.
From this blood flow simulation, we can obtain localized information about the speed of the blood inside the ascending aorta, also about the direction of the blood flow and the local blood pressure, as well as information about the local turbulences of the blood flow.
And this personalised data translates into useful information for paediatric cardiologists on the best way to help both Giordano and thousands of other young patients.
Compared to a healthy subject where no particular region of the aorta is under pressure, in this other study case we've been able to identify 2 risky regions. They're here in red. And there are 2 because due to its particular flow, this blood is first hammering this region of the aorta wall and then it bounces back to hit a second region.
The platform is completed with a digital database grid linking hospitals in Europe and the United States, so paediatric cardiologists from both continents can have fast, reliable, interconnected, updated and interactive access to data about the complex heart pathologies they are dealing with.
This transatlantic grid has already helped European and US clinical teams to test new simulation computer models. And they've done it without the hospitals on each side of the Atlantic having to invest in costly computer equipment.
Researchers are now adapting the same platform for use with other paediatric health issues, including rheumatism, neurological and neuromuscular diseases and obesity, for the sake of other children all around Europe.
Giordano's led a pretty normal life since he was born. He enjoys playing soccer with friends. He likes swimming.
When I'm grown up, I'd like to become a photographer or a cameraman. I really enjoy taking photos of animals and landscapes.